We know that you are busy trying to make lives better, and we hope you find your time with us today productive and that PerformWell becomes a resource for making your lives easier. So on behalf of the 3 partner organizations that bring you PerformWell, the Urban Institute, Social Solutions, and Child Trends, I welcome you. I'm going to take a moment to introduce our speakers for today, and then I'll launch into the webinar doing an overview of PerformWell and performance management. And then I'll hand it over to John Pratt for a little while to talk from his perspective, and then we'll get back into how PerformWell can help you in the various stages of performance management. So I'm Teresa Derrick Mills. I'm a research associate at the Urban Institute. I'm a former community-based nonprofit manager, and I'm one of the researchers compiling information for PerformWell. John Pratt is the executive director of Minnesota Council for Nonprofits and a PerformWell advisory board member. And Ingvild Bjornvold is the director of strategic initiatives at Social Solutions. And Social Solutions is our technology partner in PerformWell, as well as a conceptual partner. So what is PerformWell? Well, it's a package of resources, including the website, a newsletter, and these webinars. You might have been on a webinar just a couple of weeks ago that Isaac Castillo did from Child Trends, where he talked about various ways to use data, and he'll be doing another one in October talking about the culture of performance management. But on the PerformWell site, we have outcome measures, indicators, and performance management tools, guidance, and strategies. All of the information is research-informed and practitioner-guided. We want it to be useful to you, and it's free, interactive, and web-based. So today we're focusing on performance management, and we think it's always good to start with a definition of what do we mean by that. Certainly not everybody has the same definition, but this is the working definition that we'll be using as we talk today. It's a dynamic process, which means it's not just a one-time thing. You don't just manage a particular activity and that's it. As you know, your work is ongoing. You're trying to serve everybody the best that you can, and performance management is a process to help you do that. It's designed to better understand program operations, monitor outcomes, and ultimately help nonprofits become high-performing organizations which produce positive results. And in terms of PerformWell, it's designed to save you time, help you select outcomes, help you determine how to measure outcomes, help you find tools to measure outcomes, and improve your performance capacity. And it has these elements in it because in the work that the partners have done, that's what we saw that you guys needed when we talked to nonprofit organizations or when we were part of them. These were the things that people said, you know, it's hard to find this stuff. It's important. We need to do it, but we could really use some help. And that's what PerformWell is there for, to help you do it. So in this webinar, we will discuss the value of outcomes in performance management and the challenges. If it were easy, we wouldn't need a tool like this to help you, and you wouldn't all be here. We'll describe the stages of performance management, and then we'll demonstrate how PerformWell can help you navigate those stages. So at some points, we'll actually go into the PerformWell site and do some demonstration. So now I'm going to hand the ball over to John, and he's going to talk to you about his perspective in performance management.
Thank you, Teresa. Well, again, my name is John Pratt. I work for an association of about 2,000 nonprofits, and we're one of about 40 statewide associations around the country. who are all formed to keep the world safe for nonprofits and to help these organizations succeed. So when we think about sort of the nonprofit sector and its challenges, clearly a big one is sort of documenting and adjusting performance, and another certainly is resources. And I want to share sort of one view of the nonprofit world, which is the nonprofit economy. If you look at this, there are 10 buckets across the top and 10 buckets across the bottom. The 10 buckets across the top are sources of revenue for nonprofits, and down at the bottom are types of organizations, 10 types of organizations. And the arrows are, the width varies by the amount of money. So you can see government is a very important source, as is state and local government, individual contributions, federated drives, foundations. The key variable here for many organizations is what is in the arrow, and often that is a set of conditions going one way. If you take the king's shilling, you do the king's bidding, and if you are satisfying customers or documenting your outcomes, you need to be able to sort of justify that to funding sources. So there's increased expectations and changing mandates, and also there's ongoing interest inside organizations from boards, from managers, from frontline direct service workers to discover more about what works and to adjust that over time. So the Minnesota Council of Nonprofits and many other groups around the country have long hoped for some type of outcomes and performance encyclopedia to help develop these measures and make them reliable. So this is exactly what we hoped would happen, that there would be a freely available and vetted viable measures to improve our work and to be a part of sort of negotiating with funding sources of, no, these are the right measures, and we can tell you what has occurred as a result. I like the word dynamic in the sense that we're still in a middle stage of development of this larger nonprofit sector and developing performance measures, and PerformWell sort of contributes a huge amount to this field and will continue to. And I think there's going to be ongoing dialogue about improving these measures and tools. We know there's a limit to measurability in complex situations. So particularly if you're dealing with humans, particularly if there are multiple inputs, since many organizations only have a limited part of any participant's time. But the overall goal is to help organizations succeed. And I think in this case, we see this PerformWell as another key support for a successful nonprofit sector. And I should say this chart was produced in partnership with the Urban Institute and the Nonprofit Quarterly, and is available from the Nonprofit Quarterly. So over to you, Christina.
Okay, this is Teresa again.
Okay.
Thank you very much, John. That was great to hear your perspective. And as we talk, I've asked John to chime in if I say anything that he wants to emphasize in particular or has a question he wants to ask. And please do send your questions. Ingvild will be monitoring them to see if there's any that we can answer during the presentation, and then otherwise we will answer them at the end. So here you see a performance management cycle, and you really start here with the develop framework item. Then you move around to identifying tools. So developing your framework is essentially how you're going to get the work done. What kinds of activities are you doing to get yourself to the outcomes that your organization wants to have? And then you need to identify the tools that are needed. And PerformWell can help you at each step of the way. Once you have your tools to measure what it is that you're doing, then you have to track the data. And and then you need to interpret the data. But what's significant about this slide is that it has these two sets of arrows. The green arrows lead to reporting out, reporting to funders who will use the information for themselves. The blue arrows show the performance management cycle. And this is what we're going to be talking about today. PerformWell can help you do both things. It can help you better identify tools and interpret your data and send it to your funders, but it can also help you do the things that you want to do in your organization to better understand what's going on and how to improve that service delivery, and then make some changes if needed. It might be that when you go through this cycle of looking at your data, you find that the target population that you thought you would be serving isn't really the ones that you're serving. And so that can help you figure out that you need to alter your recruitment efforts, maybe partner with different organizations in the community. It could be that you find out you're not having the outcomes that you had intended, and that might be a staff training issue. It might be that you're having some challenges in terms of your operating hours or your locations. Either people aren't coming in during those hours or aren't coming to various sites that you have or are speaking different languages. And if you're looking at the data, it can help you determine that you need to make changes in that regard. And then also, it could be that whatever is needed to create the outcome that you want, you're not providing enough of it. So sometimes we might set up a service delivery plan where we meet with somebody for an hour a week, and we might find that that's not having the impact that we intended. And so it might be that we need to increase the amount of time or think about what we can accomplish in the hour per week. And so the cycle, the continuous movement of the arrows shows that it's a dynamic process, as we talked about on the earlier slide. So in terms of developing a framework as the first step, many people call this a theory of change or a logic model. You might have heard a funder of yours talk about that, or an organization that's been working with you to help think about how you plan your strategies and your activities. And this arrow down here helps show what the stages are in developing that framework. So it typically has inputs that has to do with the staffing, the location, the money, the time, all those kinds of things that you have to put into something to make it happen. The activities are usually the strategies, so it might include things like counseling or tutoring or mentoring or any variety of activities, those strategies that you have. And next come the outputs, so counting the numbers of things that you're doing. So if you're counseling people, it's the number of people that you've counseled. If you're providing workshops, it's the number of people who come to those workshops, and sometimes also the number of workshops that you provide. And then you get to your outcomes. What's the end result of all of this? If you've counseled somebody, what happened? Did they overcome whatever barrier it was that they came to you for help about? If they were at a workshop, did they learn some new tool that helped them in their life in some way? And so the developing a framework helps you connect all the various pieces of what you're doing to that outcome stage. And PerformWell can help you with developing a framework primarily by providing you resources. So this is a view of a page in PerformWell, and it has these resource links on it. So you would start at the home page and go to About Us, and then to Performance Management, and then there are these various resources that can help you in the various stages of performance management. But in particular, the Logic Model Builder and Logic Model Development Guide can assist you in putting your framework together. The other way that PerformWell can help you with your framework is to help you think about the things you need to think about. So in this example, I'm looking at a job training program. And so 2 of the activities in the job training program are the things that the program does: counseling and training. So in this case, somebody who needs a job would come in and meet with a counselor. It could be different kinds of intensities. It could be certain target populations, and talk to the counselor about what barriers they're experiencing, and the counselor would do some kind of assessment with them to help them figure out a plan of action. They also have training that addresses certain components to being able to find a job and keep a job. And so this particular program needs to figure out, okay, if I have these activities, then what are the appropriate outcomes, and how am I going to demonstrate if I'm meeting them? So some of the outcomes that they might choose from are career advancement, job placement, and job retention. All of those outcomes might be appropriate, but sometimes only some of them are appropriate, and it depends on really what your activities are doing, what you're focusing on, what kind of target population you have tried to have. And PerformWell can help you think about those things. So I'm going to move into PerformWell now, and you should be able to see it on your screen. This is the PerformWell site. This is our home page here. And I'm going to take you to the career advancement indicator so that we can take a look at this process. So you would start at the home page and go to Identify Outcomes, and then go to Employment, Housing, and Self-Sufficiency, because we're talking about an employment program. And then again, we're talking about employment, so we want to click on the employment outcome. And it takes us to this page here. And first we get a brief definition of what employment is. And that sounds obvious, but starting with the definition is always important. And then we see what some possible indicators are for tracking employment as an outcome. And in this case, we get the options of career advancement, employment benefits, job placement, job retention, and wage level. Obviously, there could be some other ones, but in the research that we did, these are what we came up with as, having evidence-based information that was available, and tools and things that we could provide. And at the bottom of the screen, you'll see that these are the sources that we used in providing this information. And then over here, you can see surveys and assessments on the right-hand side of the screen, types of things, tools that you would be able to use. So now I'm going to go into the career advancement indicator. And in here, we see a description of career advancement itself. So what is it that we mean when we say career advancement? And any kind of indicator that you would see in PerformWell has something similar. Some are longer than others. It depends partly on how much information was available. But they're all designed to help you understand what the concept is and how it might be applicable or not to your program, so you can make that decision. So in this first paragraph here, we can see part of a definition of career advancement. Career advancement is the positive progression of an individual's working life along a career-related pathway. So it might be that you had in your mind something about career advancement, and it wasn't that. And so you might keep reading and see still if this was applicable to your program, or you might decide, maybe what I'm looking for is really called something else. In addition to that part of the definition, it also provides you with information about another way that you can think about career advancement, and that's that participants can advance by changing to different jobs that increase their earnings or hours. And then it also helps us think about what populations or the kinds of services that we're doing in our program that would lend themselves to a career advancement performance indicator. And so in this bottom paragraph here, it really talks about how it's a long-term strategy. If you're wanting to measure career advancement, you're going to have to give it some time. It also talks about potentially you only want to measure this if you're starting with entry-level employees that you're going to help move up along the way. And it talks about some of the ways that you might set up your strategies to have a career advancement indicator. And then finally, at the bottom here, it also provides you some questions to ask yourself about your program, about the participants that are in your career advancement program, how many have enrolled in other kinds of training, what percentage completed the training satisfactorily. So basically, part of what PerformWell does is help you think about what are the kinds of questions I should be asking of my program, what is the kind of data that I should be looking at. And then it helps you figure out how to collect those kinds of things with various surveys and assessment forms. And many times, either you or your funder might want to know, well, where did this information come from? And as I said before, we've provided sources at the bottom of each PerformWell outcome and indicator, and the tools themselves to let you know what kind of information we looked at as we put this together. Okay, so staying with our employment and training example, I'm going to take you to a tool in PerformWell. PerformWell has a variety of free tools, and each of those tools offer descriptions of when and how to use them, descriptions of how to use the score, and how to score the items. So I'm going to go back to the home page for a moment. And so there's a variety of ways to get back on your screen. Normally there would be something at the top here, and you can also get back using this little link. This takes us back to our home page where we have our 3 convenient tabs to navigate throughout PerformWell. And this time I'm going to go into the Find Survey and Assessments tab. And in this case, I want to look at a tool called the Job Search Readiness Checklist. So I'm going to click on the letter J to find it alphabetically. So in this scenario, I already know there's something like that out there. Or I'm thinking, okay, I'm in employment training and there's probably some tools that begin with job, and so I want to check out and look for what they are. But in terms of the job search readiness checklist, as I press on J, I come up with 3 results. And one of them is this job search checklist that I was looking for. So I go ahead and click on that link. And first, a description of the checklist comes up. And in this checklist, it provides you with a PDF tool, and that's the case in all of our tools, unless there is a cost for the tool. And in some cases, we have included tools that have costs because they're so predominant in their field. If there was a cost, you wouldn't be able to download the PDF, but you would get information about it and how to secure the tool. The tool description provides you with what indicator this is for, what population. So in this case, the tool is for adults, but many of the tools are also for children or youth. It talks about the administration method, so how would you use this tool? And in this case, it's a self-report questionnaire, which means that you would give it to the individual and they fill it out themselves. Some of the tools are interview tools, so in many cases a parent or a teacher observes the behavior of the person that the tool is assessing. This information also provides the number of questions of the tool, and then it provides you with a description of how the tool was created. And then finally, it gets into scoring and benchmarks in using the tool. And I'm not going to talk about that right this moment because Ingvild is going to talk about that soon. Okay. So we're going to go back to the webinar. And this is what I've talked about, that PerformWell offers free tools. And the job search readiness checklist was one of the tool descriptors that I went to. And this is a little bit of what it looks like on the page. So if I had pressed download PDF, you would have seen this part of the tool. In fact, you would have seen the whole tool. So the download PDF allows you to get to the information. You literally do download the PDF. You can start using it right away. We've secured the permissions already, so they won't appear on our site if you're not allowed to use them for free. So you don't have to worry about checking with the creators of the tool to see if you can use it. And you're free to modify them as well. So it might be, and some of the tools say this, that they're really more of a description of something that you could use and that you would modify it specifically for your program to meet your program's needs. And so now I'm going to turn the presentation over to Ingvild.
Great, thank you, Teresa. And Teresa was just mentioning that you can modify some of the tools. In the next PerformWell newsletter, we're actually going to have a little interview with Myra Appleby, who is somebody who took one of these tools and modified it to meet the needs of her organization. So what I wanted to talk about is the next step, which is once you know what to track, which is what Teresa has talked about, the specific tools, then you need to figure out how to track it or where to track it. And of course, there are many ways that you can do that. You can track it on using just pen and paper. Like Teresa said, you can download the PDF and really, in most cases, give it directly to your participants to fill out there immediately if it is a self-report questionnaire. You can also collect all of that data, enter it into Excel, for example, to do analysis. You can use an Access database. Some people will use a customized database or a custom-made database, and then you have customizable performance management systems like ETO. And one of the options that you saw in on the tool screen that Teresa showed was this Use in ETO software button. So Social Solutions as a company, one of our motivations for becoming one of the founding partners of PerformWell was that our customers need ways of measuring what the outcomes that they want to measure, and basically everything that's in their logic models or theories of change. They need to figure out what to measure, and they find that in PerformWell. And they are able to click on this Use in ETO software button and download the tool into their instance of ETO software. And that means that if there's any scoring, there are calculations, things like that included in the tool that's described in PerformWell, all of that would then be incorporated into the tool that they download into their instance of ETO software so that calculations are done automatically, for example. The other option is for those who do not have ETO software but want to try it, they can also click on this button and then they get a free version of ETO that's very basic and just allows them to see what it looks like with that particular tool in ETO. So that's what that button means, using ETO software. And in order to be able to make use of the data and really use it in performance management, there are some things that are important to consider. So, and one of those things is having access to real-time data. That basically means that once you have data entered into the system, whatever system it is that you're using, it's important to be able to access that in the form of reports pretty quickly. Ideally immediately. It depends a little bit on the type of data. Say, for example, you have a program that has an attendance policy that's very specific. If you're working with a population that is particularly hard to serve, for example, it may be a workforce development program or an educational program. You may have attendance policies like if people do not show up a day, you call them. And then if they do not show up for 2 days and you still have not heard anything from them, perhaps you go and seek them out, whether it's in their home or somewhere else in the community. So programs that have that kind of those kinds of policies, as an example, would need to be able to access that data immediately so that they can then act on the data and do what their program intends to do. The other part that's important to think about is having the ability to check on the quality of the data so that you're sure that data is timely and accurate and will actually be meaningful in the reports on performance that you'll be running. Because staff will need to be able to assess the progress of individuals, for example, so that they can, say, share that with clients. In some cases, that can be useful in terms of encouraging clients, like in programs like substance abuse prevention programs, for example, being able to, where it takes a very long time to really see change, and it can be difficult. There's relapse. There can be multiple instances of relapse. And being able to show clients how they actually have progressed over time despite relapses, for example, is something that can be encouraging to those individuals. In other cases, I know many of you probably were on the webinar that Isaac Castillo hosted last time, and one of the examples that he's used in the past is that staff at the Latin American Youth Center were able to share a report of how a particular young person was doing, that young person just took with him straight to the judge and was able to show the progress that he had been making, and the judge was very satisfied with seeing that data. So there are many, many reasons why it's important for staff to be able to access this kind of data pretty quickly. And then going back to the framework, the logic model or theory of change that Teresa was talking about, the managers then need to be able to use the data to figure out whether the program is on track. And so that may have to do with things like looking at attendance benchmarks, for example. If there are attendance benchmarks, like we expect participants to be present at least 95% of the time, then managers will want to look at that and at an aggregate level to figure out whether that's actually the case. And if it's not the case, then what do we need to do to change that? So that would just be one example, that in the context of the entire theory of change or logic model, they will want to look at aggregate data in various ways. And one of those, I think when we get to the point of looking at how to interpret the data, that becomes very, very clear. And then finally, of course, you want to be able to use data for funders. So when you have a system that can do all of these things, you're collecting the data. The next question immediately becomes, how much is good? What do we need to reach in terms of scores? What should we be aiming for? What kind of benchmark should we be aiming for? That's one of the biggest needs that I've seen in my work with nonprofits over time, that they collect all the data and then they want to know, well, is this good or is it bad? How do we compare with other organizations? For just one individual, how much is good enough, perhaps to achieve further outcomes, longer-term outcomes, if we're talking about a short-term outcome. So one of the things that PerformWell does to meet that need is, for each tool, there's a section that's called scoring and benchmarking. And in that section, we make an attempt to explain how you might want to score the tool. There may be numeric weights associated with answer options, for example. There may be total scores, average scores, things like that will be explained in that section. And also how much is enough whenever we're able to do that. So in this case, the example is the job search readiness tool, where it's explained how ideally a participant should be able to check off everything on the list before they go on their job search. So that's what we try to do at the level of each tool, which then applies to each individual in an organization. And I think, Teresa, I will hand it right over to you to move forward to the next section, which is the improving service delivery section.
Thank you, Ingvild. Okay. So as Ingvild talked about, we've moved through many of the cycle pieces, and we're now at the top of the cycle where we're actually getting into improved service delivery. So this is the point where if you were reporting out to the funder after interpreting your data, it would go to the funder and that would go outside of your organization, and that funder would use the information that you provide to them to interpret how they performed, in essence, because that's often why they want information from an organization, partly to see that the money was used appropriately and partly to see that when they gave you the money to accomplish a goal for them, that they're in fact accomplishing what they had hoped with that grant to your organization. But inside your organization, when you're interpreting the data, then you want to feed it back into your organization, back into the programs that it came from, and use it to improve your service delivery in some way. And we talk about improving service delivery, but it doesn't necessarily mean that there was something wrong. It could be that you're looking at the data and it's confirming, yes, everything is working the way that we thought. But it's partly that dynamic way of monitoring that information, looking at it all the time and then using it. I wanted to point out that one of the things that Ingvild said when she was talking about tracking data and interpreting data, she talked about both staff and managers. And when Isaac does the next PerformWell webinar, he'll be talking about creating a culture of performance management. And really, performance management works best if everybody buys in that the data is important. And that can be a challenge sometimes. Most of the time, people don't get into direct service delivery with the thought that they're going to be collecting data and using data. They got into it because they want to help the people. But in truth, collecting data and looking at the data can allow you to help the people more. Isaac will talk more about how you can help make that shift in your organization so that people don't feel like the data is some other thing, but it's really part of your program and a way to make your program function better and be able to do more. So improving service delivery is really all about using the data, assessing how your program is operating. And I'm just going to focus on two elements here because there's a lot of different ways you could use the data because there's a lot of different data that you could be collecting. But two of the elements that we focus on in PerformWell are looking at your target population. Is the population you're serving right now the right one? And by the right one, we mean the one that you had intended. Most of the time, you have a target population. It might be targeted by where people live. It might be targeted by their age. It might be targeted by their skill set. But the point is, are you serving the one that you had intended? And then, are your clients getting enough service to make a difference? In some of the technical language, they call this dosage, kind of like the dose that you would get when you're taking a prescription. Is it 1 pill or 2 or 1 tablespoon or 2? In this case, it has more to do with the number of visits or the number of hours. But the point is the same. How much service do you need to make a difference? So in PerformWell, there are a variety of tools in the improved service delivery area. So some of the tools are focused on outcomes, and some of the tools are focused on tracking various elements that can help you improve your service delivery. Here's a piece of a tool here called the Sample Enrollment Criteria Checklist, and this comes again from a workforce development program. And in this case, the checklist helps them see whether or not participants meet income guidelines, whether they live in the geographic area, the right age group, are they of a particular subgroup, and do they meet physical requirements? And actually, there's more on this checklist if you went into PerformWell to download the tool itself. But it helps you think about, as the service provider, are these the right questions for me to be asking, or would they be other ones? In this case, you can use this tool in multiple ways. So it might be used as a screening tool to determine eligibility from your program up front. It might be something that you have your counselors or staff members fill out each time they talk to somebody to say whether or not they meet the criteria. And it might be that you're looking for them to meet more of the criteria, like say you can't serve everybody. You would use a tool like this to help you figure out these are the most at risk, or the people who most need our help or meet the most criteria, and therefore we're going to serve them first. You can also use it to assess if you're getting the right people coming in the door. So as your staff fill out this checklist, you would hope that most of the people that are coming in for your service do meet the criteria, especially if your organization serves a fairly narrow population to begin with. But the point of creating your target population typically is, what group does your organization want to serve, and is often, your mission is focused on serving those particular people. So the checklist can help you if you see a pattern. So each person is filling out this checklist for each person who walks in the door. You could put this checklist into an Excel spreadsheet so it's easy to tally together at the end. And then you want to look at it and see, are most of the people meeting criteria? That's good. Are most of the people not meeting criteria? Oh no, what's going on here? Why are so many people coming in the door who don't meet the criteria? Does it mean that our neighborhood has changed? Does it mean that there are different kinds of people coming to seek services from our organization? Or does it mean that we're recruiting in maybe not the most targeted places? I know when I worked in nonprofit, we often relied on our partner organizations to help us with recruiting. We would send them emails or send them flyers to put up in their offices and their waiting rooms, and we would post things at the library and all around town, and we'd really have to think about, where does the population go that we want to become aware of our services, so that they would see our materials and give us a call or come in. But sometimes we lose touch with the population, or the population changes. And so paying attention, looking at these kinds of information as they come in, can help us make adjustments. Sometimes we won't be able to make adjustments right away, because it might be that the money we got from our funder was specific to a particular population, but it could then be
Teresa,
used. Yes.
Teresa, I was just going to add, and possibly that's a source of negotiation with a funding source, that we can inform you, actually, our community is changing and the needs are changing. We need to renegotiate or adjust some of the conditions of our funding. So this information can be very helpful in that, helping educate the community, too, about these changes.
Right, and so the point here is that you be collecting the data all the time and looking at it all the time, and then using it. And so what Ingvild talked about in terms of having real-time access to the data can really be helpful. You definitely want to make sure whatever system you create for tracking is as easy to get out as it is to get in, so that you can really use and look at the data. Okay, so the next thing that we're going to look at has to do with the support that the participants are getting. And this screen is taken from a page in PerformWell. And I picked this one in particular because it talks about support from two different ways. So again, here, when we talk about support, we're trying to think about how much of our service does somebody need to experience the outcome that we want them to experience. So using a mentoring program, for example, is it enough to meet with a child 1 hour every month? Are they going to experience the kind of change that we had hoped for them? Is it enough to meet for a tutoring program with a student in high school for 1 hour per day? And so it's looking at it from two different perspectives. One is, how much service are we actually providing? So looking at creating some tracking records for ourselves. We might have a goal of how much we're going to provide, but we need to keep track of whether or not we actually did, and whether or not the person actually came. So there's, a few different levels there, and I'm sure that you've all experienced this, that you plan it out a certain way, and then people's lives are busy, they can't come all the times that you had expected them to, and so they're not getting as much support as you had intended for your program. And then the other side of it is whether or not the participants feel like they're getting the support that they need, which is this second one here. So assessing whether participants actually experience being supported. And in that case, that would involve doing a survey of the participants or talking to the participants and finding out, you might think you're not giving them enough, but then you might hear from them that they feel like it's great. Or it could be the other way around, where you feel like you're giving a lot, but the participants say, well, it doesn't really feel that way to us. And when it doesn't feel that way to them, it could be a few different reasons. So performance management helps you identify where there are things that you want to look into more. It does not tell you right off the bat what it is that is going wrong necessarily, or that you might want to fix, but it helps point you in the direction. And the tools and the questions and the strategies and resources in PerformWell can help you think about what might it be in my program? What might I want to look at more deeply and get some more information on? So the participants might say, well, you're spending a lot of time with us, but we're not really feeling supported because of the way you talk to us when you spend that time with us. Or you're not spending a lot of time with us, but when you do, we feel really important. And so it's really enough. We feel respected, and we feel like you really care about us. And so it can go either way. But the point is, you won't know that unless you're talking to people, you're collecting that information, and you're looking at it. And you're really committed to feeding that back in to making changes in your program. So that brings us back to the performance management cycle. Again, the green line is what happens. You begin your framework, you identify tools, track data, interpret data, and report it out to the funder. But the blue line and the blue circle that denotes the dynamic of the performance management cycle shows you creating your framework, identifying tools, tracking data, interpreting data, and improving service delivery because you want to know what's going on in your program and you want to be able to provide the very best services that you can. And you're willing to continuously look at that process. So that concludes the main part of our presentation. There's contact information for me and for Ingvild, as well as overall contact information for PerformWell. John, did you have anything you wanted to add?
No, just that. Thank you. It's obviously a great resource and a growing resource. Did you want to say anything about the ratings that users will be able to rate the tools?
Sure. On each page, there's a place where you can assign a star rating to a tool and write a comment about what you think about it. We would really like to get your feedback. You can do that there, or there's also a general place where you can send information. But if you do use the rating tool on the page, then you can actually share that with the other people using PerformWell. So I'm trying to get back to the page here just really quickly. And down here at the bottom, you can vote and rate that listing. So you can help your fellow nonprofiteers, find out what you think are the best tools and items to use in PerformWell. Ingvild, did you have anything to add?
I would just like to acknowledge Marty Miles at Public-Private Ventures, who led the effort to create the workforce content that we've been using as an example today. She was assisted by Siobhan Mills, also at Public-Private Ventures, and so I'd like to just thank them for that work that we've used as an example. And I think we want to tell everybody also about our upcoming webinars before we get to the questions. We do have a few questions here. So our next webinar is going to be Creating a Performance Culture. That's with Isaac Castillo and Julie Russell. And you can register at performwell.org. This is going to be on the home page now, this webinar for registration. And we've talked a little bit about fundraising today, so I also wanted to mention that in the spring, we will have a webinar that's going to be all about how to use performance data in fundraising. So it's mentioned on the PerformWell webinars page, and we will have registration available for that soon. We don't have it yet, but as soon as we have it, you will be able to register for that webinar in the spring. I know a lot of people are interested in that. And I think we can probably move right on to the questions. The first question we have here is, would PerformWell tie into the balanced scorecard system? Teresa, would you like to address that one?
Okay, let's see. I think it probably could. I think I might need to know more about your particular balanced scorecard in order to say how exactly, but the general concept there is that you're trying to look at a variety of things related to your program, and PerformWell can certainly help you do that. I'm sorry I can't be more specific.
And then we have a question about, do you have information how reliable self-reporting is as a measurement tool for adults, youth, and children?
Well, you know, that really depends on the type of thing they're self-reporting about. And actually, on our tools, sometimes we recommend that you use people's names, that is, that you track the data by person, and sometimes we recommend that you do not. And so you'll see on the PerformWell tools that you can download, if it has a name and a space for name, then we think that the data would be reasonably reliable collected that way. And if you don't, then our suggestion to you is not to collect the name. So it might be that you're getting the perspective of everybody in a particular cohort, and you're trying to see if that cohort would change. So in circumstances where the information you're gathering is particularly sensitive, sometimes it's hard to get people to report it accurately because they're worried about getting judged. But if their name is not attached to it, then they're more likely to be honest. But we try to provide as much information about those kinds of things in the PerformWell Tools section.
Okay, and we have a question from someone who is running youth programming that helps youth to find jobs and place them in subsidized employment, leadership programming, and provides case management services, one-on-one counseling to keep youth in school. And this person is asking about transition planning for youth and sort of how to approach that kind of a task, and how you sort of approach that in performance management when youth are about to transition out to the program. Is that part of data collection? Is that sort of an end goal that each participant will be transitioning elsewhere? So I think we need to talk a little bit about how to approach that kind of thing, because I guess, Teresa, one of the one of the issues that we see would be that you may achieve goals by the end of a program, but whether those goals actually stick over time is another question as a long-term goal. And generally with something like employment, programs have as their goal to help people not just into employment, but retaining that employment over time so that they will improve their lives in the future. And so some longer-term outcomes are generally either implicit or explicit. So do you want to talk a little bit about that, Teresa, the transitioning part?
Sure. First, let me just say I'm not an expert in youth transitioning from those programs, but in terms of thinking about this in a context of a logic model and then for performance management, whether or not a goal is appropriate for your program depends on your particular strategies and how you think those strategies connect to what it is that you want to have happen for the youth. You can have a goal of the transition itself and in terms of what the youth accomplish in that transitioning process. And then you might have a longer-term goal to follow that youth beyond the initial accomplishment to see, as Ingvild said, whether or not what you did holds up over time. And it might be that you then want to compare that to the population as a whole that youth is a part of and what they might not have accomplished had they not been part of your program. It's hard to sort of talk about these things in the abstract because, yes, you can collect data for virtually anything that you might want to track. The challenge for tracking after someone leaves your program is maintaining that connection. But there is actually on the resource page that I showed at the very beginning of the program, if you go to that performance management page, there are some resources on there that can help walk you through some of those processes.
Okay. And we have a question from a graduate student who's pursuing her MSW. And she's saying that she's working in an outpatient branch of a community mental health center and is asking what kinds of limitations would a manager face in implementing the performance management cycle?
Okay. Well, it depends partly on what data you're already collecting. So it could be that as clients come in, people from your center enter data about them into a computer system, eligibility information about what kind of circumstances brought them into the center to begin with. And then how easy it is to implement a performance management system depends on partly on how easy it is to get that data out of the system. Some systems are made more for putting it in than getting it out. and so that often becomes the first challenge to overcome is how do you look at the information all together as opposed to just client by client so that you can see patterns across about whether or not, maybe you're attracting a particular individuals with a particular kind of mental illness, but you would rather it be broader than that. And so that's what you're looking for. You're trying to see what kinds of clients are coming in. Or perhaps you want to look at how often they're coming in for their services. Maybe they're supposed to come in once a week. And so going back to that attendance scenario that Ingvild talked about, you want to track that attendance. And it could be that you want to look at that attendance by certain subpopulations, so by kind of mental illness. Are you having more success with some than with others? And then you might drill down to see, well, why is that? Is that because of the particular mental illness, or is that because of where the services are located, or what time people come to get them? So part of it has to do with what data system do you have that you can enter your information into and get it back out again. And part of it has to do with how much time it might take people to look at that data if they're not used to doing it. Now, if you're the manager and it's something you're really interested in and you're willing to do it, then there's a good chance that there aren't going to be a lot of barriers for you. But if you need the staff to buy in, that's where you want to attend the next webinar talking about the performance culture.
Yeah, and I'd like to add to that also that in my work, I've worked in the nonprofit sector before, but working at Social Solutions, I've done a lot of performance management consulting and helping organizations actually implement ETO software, which is a performance management system that allows you to track whatever data you want to track. And one of the biggest challenges that I see that people have is with the performance management, the performance culture that we're going to talk about in the next webinar. And part of it is because people seem to kind of ignore that piece and the need for actually getting everybody on board, like Teresa was saying, because it's one thing to have a system or a tool like ETO and have a logic model and have all of that in place, but the next thing is to actually make use of the data. And so I think that human part of it is incredibly important and very frequently neglected. And when it is neglected, that can be detrimental to the whole process. So it's something that's very important to pay attention to. Let's see, we have another question here. A couple of people are asking about pricing for PerformWell and the difference between ETO software and PerformWell. So let me explain that. Teresa, I wonder, could you go back to the slide on the performance management cycle, perhaps? That might be helpful in explaining this to everyone.
Sure.
So PerformWell is a website that provides you with information on how to actually track particular outcomes or aspects of service delivery, such as service delivery quality. So it helps you answer the question, what is meaningful to track, but also how do we track it? What's a specific tool? What are the questions we should be asking? How do we score them? All of that. PerformWell does not give you a tool to actually collect the data. ETO software is a performance management system which allows you to collect the data. So data like the names and demographic information of participants, intake information, baseline information for outcomes, how are people doing when they come into the program versus how are they doing at some point later in time and when they exit the program, so you can see, have you been successful at improving outcomes? That's the difference. ETO is really about actually tracking the data and being able to run reports. It's specifically designed for frontline staff, to be useful for frontline staff as well as manager for performance management.
And Ingvild, could you describe the cost of that?
I cannot speak to the cost of that because it varies very much by organization, by the size of the organization and what the needs are. So anyone who is interested in the cost should feel free to email me or just go to socialsolutions.com to get in touch with somebody who can
But can we give a ballpark of an organization might spend sort of a range of money per year to use this software?
I'm afraid I cannot give a ballpark for that because it varies so much. But it's very easy to get in touch with somebody who can give a ballpark figure for any one organization.
So there's no minimum charge?
No, I don't know that there is a minimum. I mean,
but PerformWell itself is free.
Yes.
Yes. So everything in PerformWell is free, and this is part of what we wanted to do with PerformWell, be able to provide all of this information for free, because when I worked in the nonprofit sector, for example, one of the things that I experienced was that we needed to figure out how to track outcomes, and we needed to develop a framework, and it was so hard to find information because what you have out there is there's a lot of research available, but it's research, and so translating that into practice and performance management in practice is very challenging, and that's part of what we're trying to do with PerformWell, translating it into practice so that we can help people with figuring out what to track and how to actually measure it with specific tools. Let's see here. We do have quite a few other questions. Excuse me. We have a question. Are there any books that the panelists can suggest about performance management in the social sector? And I think there are a few books. I guess Leap of Reason would be one book. Teresa, there are some publications from the Urban Institute.
They are, and they're linked on that resource page that I showed before. There's a whole series that the Urban Institute has done for nonprofit organizations in helping them measure outcomes and look at performance indicators. There's a few volumes, and they are practitioner-focused to really help folks think about how to set up their systems and some of the tools that they might need.
Right. So, and there's something from Child Trends on there on the difference between performance management and outcomes, and then Leap of Reason by Mario Marino and a few other publications there that I think may be useful for people. For those who have asked how long PerformWell has been in existence, we have been working on it for a few years, but we launched it officially in March of this year, so it's still quite new. And many of you are wondering, are we going to add to the program areas on the website? And the answer to that is yes, yes, yes. We are going to add to the program areas, and in fact, Teresa is working on some of those additions right now.
I am. The next one that will be coming out is on civic engagement. And then we've got one we're working on for parenting skills. But essentially the way that works is just like all of you, we have to seek funding in order to provide this for free. And so we write proposals to various foundations and organizations to see if they will help support PerformWell so that we can develop more areas and continue to provide the support to you.
Excuse me. And we have a question about industry outcome benchmarks. And this question of benchmarks is one that a lot of people are interested in to figure out how their results actually compare with others, other agencies that are similar. And I think unfortunately, there isn't always benchmarks available. In some cases, there are some that we try to share, but we don't always have that kind of information available. So Teresa, do you want to speak a little bit to that question of benchmarks? Because a lot of people are very interested in that.
Sure. Well, as we investigate the research that we can find on a particular issue, we translate whatever we can find into information for all of you and put it on the website. But a lot of times we can't find everything that we would like to find. And so in the case of benchmarks, if there are benchmarks for particular tools and the tool developers have provided information about those benchmarks, or we've been able to find it in the research, then we provide that information along with the tool. But many times you will find that there is not benchmarking information, and that's because it's not been provided by anybody.
Okay, and let's see, we have a question about residential education programs. Do you have some tools or resources available for that? And I think the answer to that is probably no, not at this time.
Well, I would just add it depends on what kinds of activities and what things you're trying to accomplish. So no, we don't have an area called residential education, but we do have a variety of youth development measures and things about self-management and various social, emotional, and psychological outcomes. So part of it depends on what it is that you're trying to do, and some of our measures might be appropriate for that.
Okay, and I think that we have answered all of the questions that I have in the chat box here. So if anybody else has any questions, type them in now, and we will still try to answer those. But yeah, it looks like we have answered most of them. So Teresa, thank you for a great presentation. And John, thank you as well for being part of this with us.
Gladly.
Thank you, Ingvild.
Okay, thank you very much, everybody. And that concludes our webinar today.
Thank you.